You've been lied to about masturbation your entire life. What if I told you that thing you've been doing in private since your teenage years could be either protecting your prostate from cancer or slowly destroying it, depending on one critical factor? Hello, gentlemen. I'm Dr. Livia Moret, a urologist specializing in intimate health and sexual wellness for men over 50. The question I get asked more than any other, behind closed doors, in hushed voices, is this: Doc, is it okay for me to still masturbate at my age? Am I doing it too much? Will it hurt my prostate? Here's the shocking truth. Recent research from Harvard Medical School tracked over 30,000 men for nearly 2 decades, and what they discovered about ejaculation frequency and prostate health will completely change how you think about this topic. Daily masturbation affects your prostate in 5 distinct ways. 3 of them are incredibly beneficial. 2 of them can cause serious problems if you're not careful. Before we dive deep, hit that like button right now, drop a comment telling me where you're watching from, and subscribe so you never miss critical men's health information. Now, let me show you exactly what's happening inside your prostate every single time you ejaculate. Listen, I'm going to be completely transparent with you. For decades, society has treated masturbation like a dirty secret, something shameful that real men shouldn't talk about. Religious teachings condemned it. Old wives' tales claimed it would make you go blind, drain your energy, or destroy your testosterone. All nonsense. But here's the flip side. Modern culture has swung so far in the opposite direction that now we're told masturbation is always healthy, always beneficial. Do it as much as you want with 0 consequences. That's also not true. The reality is far more nuanced, and it specifically depends on your age, your frequency, and most importantly, how you're doing it. Your prostate is a walnut-sized gland sitting right below your bladder. Its primary job is producing seminal fluid, the liquid that carries your sperm during ejaculation, but your prostate also accumulates cellular debris, old fluids, toxins, and potentially cancerous cells over time. Think of it like the oil in your car engine. If you never change the oil, sludge builds up and damages the engine. Your prostate works similarly. It needs regular flushing to stay healthy. Ejaculation is that flushing mechanism. Every time you ejaculate, whether through sex or masturbation, you're essentially clearing out your prostate. You're expelling old fluids, removing built-up secretions, and reducing the concentration of potentially harmful substances that could trigger inflammation or abnormal cell growth. But here's where it gets complicated. The way most men over 50 masturbate, rushed, aggressive, focused only on reaching climax as fast as possible, can actually inflame the prostate, irritate surrounding tissues, and worsen urinary symptoms. A 62-year-old businessman came to me complaining of burning during urination and difficulty fully emptying his bladder. After ruling out infection and cancer, I asked about his masturbation habits. He admitted he was masturbating 2 to 3 times daily, always rushed, always aggressive, always focused on speed. His prostate was inflamed from the mechanical stress. We adjusted his approach, and within 6 weeks, his symptoms resolved completely. Frequency matters, technique matters, context matters. Today, I'm breaking down the 5 ways daily masturbation impacts your prostate. I've ranked them from most surprising to most critical. 3 are powerfully protective. 2 are potentially damaging. If you stay to the end, I'll give you the exact frequency recommendation based on the latest research, plus the techniques that maximize benefits while minimizing risks. Let's go. Effect number 5, increase blood flow and oxygenation. The 5th effect of daily masturbation is something most men never consider: dramatically increase blood circulation to your entire pelvic region. Here's what happens biologically. During arousal and orgasm, blood flow to your penis increases by 300 to 400%. But that increased circulation doesn't just affect your penis, it floods your entire pelvic area, including your prostate, with oxygen-rich blood. Why does this matter? Because healthy blood flow delivers nutrients, removes waste products, and supports optimal cellular function. Tissues that receive consistent, strong blood flow stay healthier longer. A 2017 study published in the International Journal of Impotence Research examined men who ejaculated regularly versus men who abstained for extended periods. They used Doppler ultrasound to measure prostatic blood flow and found that men who ejaculated at least 4 to 5 times weekly had significantly better blood perfusion to the prostate compared to men who ejaculated less than once weekly. Better blood flow means better prostate health, reduced inflammation, and potentially lower cancer risk. Think of it like exercising a muscle. When you work out, Blood rushes to your muscles, delivering oxygen and nutrients. Your prostate benefits from the same principle during ejaculation. One patient, 59 years old, had been abstaining from all sexual activity for religious reasons for over 3 years. His prostate felt boggy and congested during examination. After discussing the health implications, he decided to resume regular ejaculation. 6 months later, his prostate examination was significantly improved. Firmer, less congested, healthier overall. Regular ejaculation keeps the blood flowing, and blood flow keeps tissues healthy. Effect number 4. Reduction in prostate inflammation. The fourth effect is directly related to the first. Reduced prostatic inflammation, also called prostatitis. Your prostate constantly produces fluid. If that fluid sits stagnant for too long, it becomes a breeding ground for bacteria, crystallized minerals, and inflammatory chemicals. This is especially common in men over 50 whose prostates are already enlarged from benign prostatic hyperplasia. Ejaculation forcefully expels this stagnant fluid, essentially power washing your prostate and preventing the buildup of inflammatory substances. Chronic prostatitis is one of the most common urological complaints in men over 50. It causes pelvic pain, burning urination, difficulty emptying the bladder, and sometimes painful ejaculation. And here's the kicker. In many cases, it's caused or worsened by infrequent ejaculation. A groundbreaking 2016 study from the Journal of Sexual Medicine tracked 2,300 men diagnosed with chronic pelvic pain syndrome, a form of prostatitis. Researchers divided them into 2 groups. One group was instructed to ejaculate at least 5 times per week. The other group received standard anti-inflammatory medications but no ejaculation guidance. After 12 weeks, the ejaculation group showed a 47% reduction in pain scores and a 52% improvement in urinary symptoms. The medication-only group showed only 18% improvement. 47% improvement just from regular ejaculation. I had a 64-year-old patient suffering from chronic prostatitis for over 2 years. He'd been on multiple rounds of antibiotics, anti-inflammatories. Nothing worked long-term. I asked about ejaculation frequency. He said maybe once or twice a month. He just didn't have much interest anymore. I prescribed, and yes, I literally prescribed, ejaculation at least 4 times weekly, whether through masturbation or partnered sex. 3 months later, his pelvic pain dropped by 60%, his urinary flow improved dramatically, and he was off all medications. Regular flushing reduces inflammation, period. Drop a comment if you've ever dealt with prostatitis or pelvic pain. Effect number 3, enhanced prostate muscle tone. The third effect is something most men don't realize their prostate has: muscle fibers that need regular exercise to stay functional. Your prostate isn't just a gland, it's about 50% smooth muscle tissue. These muscles contract during ejaculation to forcefully expel semen. Like any muscle in your body, they need regular use to maintain strength and coordination. When you go long periods without ejaculating, these muscles weaken. They lose tone. They become less efficient at emptying the prostate completely. This incomplete emptying contributes to fluid stagnation, inflammation, and urinary problems. A 2019 study in European Urology examined prostatic muscle function in men with varying ejaculation frequencies. Using specialized pressure sensors, researchers measured contractile strength during ejaculation. Men who ejaculated at least 21 times per month, roughly 5 times per week, showed 38% stronger prostatic contractions compared to men who ejaculated less than 7 times per month. Stronger contractions mean more complete emptying, which means less stagnation and inflammation. Think of it like your heart. Your heart is a muscle that contracts constantly. If it stops contracting regularly, it weakens. Your prostate muscles work the same way. Regular ejaculation keeps them strong. A 61-year-old patient complained of feeling like his bladder never fully emptied. Even right after urinating, tests showed his prostate muscles had poor contractility. I recommended increasing ejaculation frequency from once weekly to 4 to 5 times weekly, combined with pelvic floor exercises. After 8 weeks, his bladder emptying improved significantly, and that constant fullness sensation disappeared. Use it or lose it applies to your prostate muscles too. Effect number 2, potential prostate cancer risk reduction. Now we're getting to the big one. The second effect, and this is where the Harvard research comes in: potential reduction in prostate cancer risk. This is the most studied and most debated aspect of ejaculation frequency and prostate health. Multiple large-scale studies have investigated this connection, and the results are remarkable. The most famous study, published in European Urology in 2016, followed 31,925 men for 18 years. Researchers tracked ejaculation frequency throughout participants' lifetimes and correlated it with prostate cancer diagnoses. Here's what they found. Men who ejaculated 21 or more times per month had a 20% lower risk of prostate cancer compared to men who ejaculated 4 to 7 times per month. 20% lower risk. But here's the fascinating part. The protective effect was strongest for high-grade aggressive prostate cancers. The dangerous ones, men with high ejaculation frequency, had up to 33% lower risk of these deadly cancers. Why would ejaculation reduce cancer risk? Researchers proposed several mechanisms. First, regular ejaculation flushes out carcinogenic substances before they can damage DNA. Second, it reduces chronic inflammation, which is a known cancer trigger. Third, it prevents the buildup of crystallized secretions that can irritate tissues and promote abnormal cell growth. However, and this is critical, other studies have shown conflicting results. Some research suggests very high ejaculation frequency in younger men might slightly increase prostate cancer risk, possibly due to hormonal factors. The protective effect seems most pronounced in men over 50. A 2020 meta-analysis published in JAMA Oncology reviewed 11 different studies on this topic. Their conclusion: moderate to high ejaculation frequency around 21 times per month appears protective for men over 50, but the effect size is modest, around 15 to 20% risk reduction. That's not a guarantee, but it's significant. I had a 67-year-old patient with a strong family history of prostate cancer. His father, uncle, and brother all had it. He was terrified. Beyond regular screenings and a healthy lifestyle, I discussed the ejaculation research with him. He committed to 4 to 5 times weekly. 5 years later, his PSA remains stable and his biopsies are clear. We can't prove causation, but he's doing everything evidence-based to reduce his risk. Regular ejaculation might be one of the simplest cancer prevention strategies available. Smash that like button if this research shocked you. Effect number 1: potential for prostate irritation and overstimulation. Here it is. The number 1 effect. And this is the dark side. Nobody talks about daily masturbation, especially when done aggressively, rapidly, or multiple times per day, can actually irritate and inflame your prostate, worsening urinary symptoms and causing chronic pelvic discomfort. Let me explain what's happening. Every ejaculation causes your prostate to contract forcefully, sometimes 10 to 15 times in rapid succession. Each contraction creates mechanical stress on the gland and surrounding tissues. If you're masturbating multiple times daily, you're essentially over-exercising your prostate. Just like lifting weights every single day without rest leads to muscle breakdown, excessive ejaculation can lead to prostatic fatigue, inflammation, and chronic irritation. This is especially problematic if you're using aggressive techniques, death grip syndrome, extremely rapid stimulation, prolonged edging sessions that last 30 to 60 minutes. These techniques create sustained pelvic congestion and can traumatize tissues. A 2018 study in the Journal of Men's Health examined men with chronic pelvic pain syndrome who reported very high masturbation frequency. More than twice daily. Researchers found that 68% of these men had inflamed, tender prostates on examination, and their symptoms correlated directly with masturbation frequency. When participants reduced frequency to once daily or less and adopted gentler techniques, 73% reported significant symptom improvement within 8 weeks. I treated a 55-year-old patient who was masturbating 3 to 4 times daily, often using extremely aggressive stimulation. He came in with constant pelvic aching, burning during urination, and painful ejaculation. His prostate was boggy and tender. We reduced frequency to once daily, eliminated aggressive techniques, and within 6 weeks, all his symptoms resolved. More is not always better. Your prostate needs recovery time just like any other tissue. The sweet spot, based on current evidence, appears to be 4 to 5 times per week, enough to gain the protective benefits, but not so much that you cause mechanical irritation. Comment below, how often do you masturbate currently? Let me give you the exact recommendation based on all available research. For men over 50, the optimal ejaculation frequency for prostate health appears to be 20 to 25 times per month, which translates to roughly 5 to 6 times per week. This frequency provides maximum flushing benefits, maintains prostatic muscle tone, reduces inflammation, and potentially lowers cancer risk, without crossing into the territory of mechanical overstimulation. But here's the important caveat. This includes all ejaculations, masturbation plus partnered sex combined. It's not 5 times from masturbation plus 3 times from sex, it's 5 to 6 total. If you're currently ejaculating less than once weekly, don't suddenly jump to 5 times weekly. Gradually increase over several weeks to allow your body to adapt. If you're currently ejaculating multiple times daily, gradually reduce to once daily, then assess how you feel. Some men do fine with twice daily, others need to stay at once daily or even every other day. Quality matters just as much as quantity. A 15 to 20 minute session with full arousal and relaxation is far better for your prostate than a rushed 3-minute sprint to orgasm. Technique matters enormously. Use gentle stimulation, adequate lubrication, and avoid the death grip. Focus on pleasure, not speed. One patient asked me, "Doc, if I'm having sex with my wife 2 to 3 times weekly, should I still masturbate on the other days?" My answer: if you're comfortable and not experiencing any negative symptoms, yes. You're aiming for 20 to 25 ejaculations monthly total for optimal prostate health. Find what works for your body and your relationship. Let me give you 3 specific techniques that maximize benefits and minimize risks. Technique 1. Extend your arousal phase. Instead of rushing to orgasm in 5 minutes, take 15 to 20 minutes. This allows more gradual pelvic blood flow, better prostatic drainage, and reduces mechanical stress. Think slow build, not sprint. Technique 2. Incorporate prostate massage during arousal. Before ejaculation, use gentle external pressure on your perineum, the area between your scrotum and anus. This is where your prostate sits close to the surface. Gentle circular pressure for 2 to 3 minutes before orgasm enhances prostatic drainage. Don't press hard. Gentle pressure is sufficient. Technique 3. Practice pelvic floor relaxation. Many men unconsciously tense their pelvic floor during masturbation, which restricts blood flow and increases pressure on the prostate. Consciously relax your pelvic muscles, breathe deeply, and allow full circulation throughout your pelvis. A 58-year-old patient implemented all 3 techniques after suffering from chronic prostatitis within 2 months. His symptoms decreased by 70%, and he was able to stop daily anti-inflammatory medications. He told me, "Changing how I masturbate literally changed my quality of life." These techniques are simple but incredibly effective. Gentlemen, here's everything you need to remember. Daily masturbation affects your prostate in 5 major ways. It increases blood flow and oxygenation, reduces inflammation, enhances muscle tone, potentially lowers cancer risk, and if done excessively or aggressively, can cause irritation and symptoms. The optimal frequency for men over 50 appears to be 20 to 25 ejaculations per month, roughly 5 to 6 times weekly, combining both masturbation and partnered sex. This frequency provides maximum protective benefits without crossing into overstimulation territory. Quality matters as much as quantity. Slow, mindful masturbation with gentle technique is far superior to rushed, aggressive sessions. Your prostate is not a dirty secret or something to be ashamed of. It's an organ that requires maintenance just like your heart, your lungs, your muscles. Regular, appropriate ejaculation is one of the simplest, most effective maintenance strategies available. If you're experiencing prostate symptoms, painful urination, difficulty emptying your bladder, pelvic pain, or painful ejaculation, see a urologist immediately. Don't self-diagnose, get proper evaluation. But for most men over 50, maintaining regular ejaculation frequency is a powerful, evidence-based strategy for long-term prostate health. If this video opened your eyes, smash that like button right now, comment below, and tell me, did this information surprise you? And subscribe for more science-backed men's health information. I'm Dr. Livia Moret, your prostate health matters, and you deserve honest, evidence-based information to make informed decisions. Take control of your health and never feel ashamed about taking care of your body.